young adult woman. Let me give you the quick announcement about the poster session. The poster board will be ready by 1 p.m. today on the first floor. So after the lunch, you can go up there and put up your poster. The poster session will be held from 5 p.m. to 6:30 p.m. today. Okay, here is the Dr. Garg.
Very good morning to everybody, chairperson and delegates. I am Dr. Sandeep-Maulana Azad, Professor, Department of Medicine, Maulana Azad Medical College, Delhi, India. Topic on which I am doing a talk is the effect of different methods of weight reduction on nutritional status of young adult women. As you know, obesity is one of the major health problems of developing countries. According to WHO, any person who is BMI is more than 30 is labeled as obese, and those between 20 to 25 is overweight. It is an important part of the metabolic syndrome along with insulin resistance, diabetes mellitus, hypertension and dyslipidemia. According to one of the study, obesity leads to impairment of health and poor quality of life. It increases the risk of atherosclerosis, gout, gallbladder disease and liver diseases, along with some of the malignancies like breast and endometrium cancers. It is not only the disease of rich, it is increasing now in low and middle income group all over the globe due to bad dietary habits and sedentary lifestyle. Obesity rates, according to one study published in Lancet in 2011, the obesity rates rose from 10.6 to 12.6 between 6 years, from 1998 to 2006, and that too more in urban areas. In India also, the prevalence of obesity is increasing, and it ranges from 30 to 50% in metropolitan cities like Delhi, Jaipur, Chennai, and that too more in women. Another study by S. Puturaj showed that prevalence of obesity in metropolitan cities like Bombay and Delhi is around 48.5% and 28.3% respectively. So the aim of my study is to study the nutritional status of young adult women before and after weight reduction by various anthropometric measurements, biochemical parameters, clinical assessment, and their dietary intake. This study was conducted in New Delhi, India. 30 subjects, 30 young women from 18 to 29 years of age with BMI more than 25% were selected by simple random sampling method. A well-designed structured performer was made, which was tested first on 5 subjects, and based on the responses and difficulties raised, it was modified to make it more functional. An interview schedule was laid down to evaluate the knowledge of the respondents regarding nutrition and different sources of information like advertisements, radio, etc. in regard to obesity and its control. So the various information regarding the socio-demographic profile, nutritional status, different methods of reduction was gathered by using this pre-designed structured questionnaire before and after weight reduction intervention done for 6 months. General information like age, sex, marital status, occupation, their socio-economic personal constraints, income group, their education status, their activity level, their eating pattern, dietary history like food habits, food preferences, eating out pattern, their snack intake per day, number of meals taken per day, smoking, alcohol pattern, mean consumption pattern and dietary intake was calculated by 3 consecutive days by 24-hour Regal method. And other information in regard to weight control, various methods of weight reduction, knowledge regarding the weight control was gathered. In regard to dietary information, standard size bowls, spoons, glasses were shown to the respondents to facilitate them in estimating the amount of food consumed. Information regarding the ingredients of the food consumed and method of cooking were also recorded. Data regarding their activity level, lifestyle and eating out pattern was collected. Anthropometric data like height, weight, BMI, waist circumference, hip circumference, waist hip ratio was recorded. Biochemical parameters like hemoglobin, lipid profile was done in each and every case. The intake of different foodstuff was calculated and compared with recommended dietary intake. Nutrient contents like energy, protein, carbohydrate, fat, calcium, iron, retinol and dietary fibers were calculated using nutritional analysis software and compared with recommended daily allowance as per ICMR guidelines. Nutrient dedication ratio for all these nutrients was calculated using the formula nutrient dedication ratio is equal to nutrient intake into 100 divided by nutrient recommended daily allowance. Similarly, the food consumption pattern of the respondents was observed and compared to the recommended dietary intake. the food adequacy ratio for all the food groups like meal, cereals, pulses, vegetables, roots and tubers, foods, fats, oils and sugar was also calculated using the formula food adequacy ratio is equal to foodstuff intake into 100 divided by foodstuff RAA. This data was all gathered and statistically analyzed with the help of percentage, mean, standards and t-test and z-test. So this is a table showing the baseline profile of the patients. The mean age was around 25. There were 30 subjects and 60% belonged to the mid-income group and 60% were around graduated. According to a study by Bakar et al., it has shown that those who have attained poor education level have got poor diet controls, and the poor faulty dietary habits and sedentary lifestyles are the major culprit for obesity as shown by Joshi et al. In this slide, around 46% were non-vegetarian and around 46.7% consume 2 snacks per day. Around 13% consume alcohol. None of the respondents was smoker. The most important source of information regarding the obesity control was 66.7% from the television and around around hypothyroidism, which was the main culprit, was seen in 13.3% of the patients as a cause of obesity. These were the different methods used for weight reduction. Self-dietary modification or the dieting was the main method of weight reduction, though combination of methods were used. This was followed by aerobics in 40% of the cases. Coming to the results, around 43% of the subjects were satisfied with their weight loss, but still 33% want to shed more weight. Total time spent was around 3 hours or more. Coming to the dietary results, the whole of the subjects were divided into 2 groups. One is sedentary lifestyles and those with moderate activity. Around 70% belong to sedentary lifestyles and around 30% belong to moderate activity groups. So this is a comparison of mean daily nutrient intake of respondents in sedentary activity. I show it by diagram. The energy intake, the protein intake, the fat intake after 6 months of weight reduction has decreased, while the calcium intake, iron intake and zinc intake, retinol, and similarly the dietary fiber has increased in this group. Coming to the moderate activity group, you can see there is a drastic reduction in the fat intake. Similarly, the energy intake, the protein intake this intake was decreased as compared to the sedentary activity and in this moderate activity group also. However, the zinc intake and the fiber intake was much more and it was significant as compared to sedentary activity group. Regarding the clinical assessment, none of the subjects have cirrhosis or magenta tongue. Angular stomatitis was similar after weight reduction. There was a significant reduction in the cheilosis which was seen in 20% of the cases and none of the subjects has this cheilosis. This was regarding the hair loss. According to study by Lotkin, if a person does weight loss that too is very drastic, he may have drastic hair loss, but in our study I didn't find any of the subjects having hair loss. Tingling sensations improved they were initially present 30% of cases, but they improved and only 10% of the patients have tingling sensations. Apple-shaped obesity was seen in 6.7%, it remained same. Pear-shaped obesity remained same in both the groups. Coming to the nutritional assessment, this is an important table. If you see the this is the percentage reduction after weight loss. So if you see the energy intake, this is in both the groups. Energy intake, protein intake, fat intake and carbohydrate, they are drastically decreased in both the groups. Similarly, regarding the biochemical profile, the cholesterol has improved. The LDL levels, which is the bad culprit, bad cholesterol, has improved, and it improved to a level of 13%. Similarly, the blood pressure, there is a mean reduction of blood pressure in both systolic and diastolic blood pressure. The blood glucose level improved to a 6%. And anthropometric measurements, the weight and BMI, the mean weight loss was around 20% as compared to the initial weight loss. The waist circumference, hip circumference, it reduced to 7.7%, and waist hip ratio was 0.7%. This is again the same, the energy, protein and fat carbohydrate reduction, while the calcium intake, iron intake and zinc intake and dietary fiber intake has increased. A study was conducted by Melanson which shows that around a reduction of 500 to 100 kilocalories of decrease in calories can lead to significant weight loss, and a low carbohydrate diet can lead to significant weight loss. However, dietary calcium intake was found to have inverse relation with the obesity as compared to different studies. This is the same, that their weight was reduced, BMI was reduced, hip circumference weight both were reduced. Regarding biochemical parameters, again the cholesterol has improved, the bad culprit LDL has decreased, there was an improvement in the high density lipoprotein levels. Regarding the food consumption pattern, if you see here, the intake of fats has decreased, sugar, fried food, which includes fat and sugar, has decreased, while the intake of vegetables, it has increased, and the fruit has increased. According to study by Daniel Sees et al., have found that if you take around 100 gram of vegetables per day, it will lead to reduction of around half a kilo of weight after 6 months. And similarly, an intake of 100 grams of green leafy vegetables, it will lead to a reduction of around 300 grams of weight after 6 months. So to summarize, higher percentage of humans in my study were single, working and graduated. 70% belong to sedentary. The respondents adopted self-diet modification as a method of weight reduction. The effect of weight reduction was observed through nutrient intake, biochemical parameters and clinical assessment in this study. There was a significant reduction in the intake of energy, protein and fat and carbohydrates after weight reduction. However, the intake of calcium, iron, zinc and retinol and more of dietary fiber improved after weight loss. The levels of good cholesterol HDL were improved, whereas levels of LDL triglycerides decreased. There was a 3.5 reduction in the level of systolic blood pressure. The anthropometric measurement showed a reduction in percentage after weight loss. And a food consumption pattern also showed a significant difference. To conclude, positive improvements were seen in the nutritional status of the respondents along with improvement in their anthropometric and biochemical parameters. There is a decrease in consumption of sugar and fats which leads to decreased BMI. Self-diet modifications, especially decreasing the energy intake and increasing the fiber in the diet. And walking is a powerful tool to reduce weight. A change in the behavior in lifestyle is required to combat this obesity. A small recommendation: a well-balanced diet with adequate nutrition and diet with extreme macronutrients, which are usually deficient in micronutrients, are difficult to follow and for long times, and they are not advocated. Similarly, the limitation of liquid calorie intake and reduction in sugar, sweetened beverages is recommended. Resources for implementing dietary recommendations should be reliable. Evidence-based resources for weight loss should be adopted, and unrealistic promises for weight loss should not be made. Selection of appropriate weight reduction therapy is important. Lifestyle management techniques should be adopted. That's it. Thank you.
Now I'll send to the question for Dr. Garg. I have a question. You just distinguished between physical active and inactive group. What's the criteria you determine active and
Both the groups were active. One of the group was sedentary lifestyle, second was the moderate activity. And the criteria was less than 4 hours of work and more than 4 hours. If a person works more than 8 hours, it was taken as an activity.
What do you think between energy intake, control of the energy intake and energy expenditure, which one is a more important factor to cause weight reduction?
It is the fat and the sugar. These are the two main culprits. If you reduce this, this will lead to weight loss.
So which one is, do you think is more important between energy intake, decrease energy intake and increase physical activity, energy expenditure? Which one do you think the more important?
I think in my study I found that decreasing the diet content is more important
than physical activity.
Physical activity is too important, but in my study I found that decreasing those who have decreased their diet, especially the fat and the sugar, they have benefited a lot.
Okay. Thank you.
It's a small study, only 30 subjects are there.
Right, thank you.